Hello, my name's Courtney. I am the nurse practitioner student here to take care of you. So why did you come in today? When did you notice the pain starting? Do you remember the events leading up to the pain? Where specifically do you feel the pain? What would you rate your pain, with 0 being nothing and 10 being the most pain? How long does the pain last? What makes the pain worse? Are there certain arm movements you can and cannot perform? Are you able to hold objects? Are you able to do your ADLs, like put on your clothes, wash your body, etc.? What makes the pain better? Are you taking any medications or putting ointments on the affected area? Do you have full range of motion? Any numbness or tingling in the arms or hands? Any snaps or catches when you move your shoulder or your arm? Any changes in the color of the skin? Have you had shoulder problems in the past? Do you have any allergies to the environment, food, or medications? And do you have any chronic medical conditions? And is there any history of joint problems in your family? All right, so what it looks like to me with one of the differential diagnosis would be shoulder impingement. This is with pain in the shoulder, with shoulder movements, and a decrease in range of motion of the shoulder suggests that there's this impingement. And as a welder, you do repetitive motions. You use your shoulder and your arms in awkward positions, which can cause inflammation and the inflammation causes the impingement in that joint. This usually is a gradual impingement that develops due to the repetitive motion that irritates the joint, which causes the inflammation. The inflammation occurs when pressure is put on that part of the joint, and then you start to have that pain and decreased range of motion. This gets worse over time, and it actually feels worse at night, which affects your ability to fall asleep and stay asleep. Shoulder impingement gets worse with certain movements or positions, like extending your arm above your head, lifting and lowering your arms, reaching for something, laying on the injured side, and reaching behind your back. Some other differential diagnoses that could be possible would be rotator cuff tear, adhesive capsulitis, which is a frozen shoulder, biceps tendinopathy, and shoulder labrum injuries. Tests that we performed to help get to your differential diagnosis would be the NIRS test. We did the Hawkins-Kennedy's test, the Yocum test, the empty can test, painful arc test, cross arm adduction test, external rotation resistant test, and drop arm test. Now, we would go further to do an ultrasound of your shoulder and arm, and or an MRI if problems persist. As far as treatment, what we would recommend is that you apply ice to the affected area 15 minutes 3 times a day. That you use heat for 15 minutes to help improve that blood flow to that area, to help that healing. We would prescribe you ibuprofen 800 milligrams 3 times per day for 2 weeks for the pain and inflammation. And then we would have you follow up with us again in 2 weeks. We would also prescribe that you go to a physical therapist for evaluation and treatment for those 2 weeks. Plus, we would like them to help you with the ergonomic plan for your home, the things that you do at home, driving in your car, and how you use your arms and shoulders, and for work. So this could definitely help with decreasing of pain and injury and further injury. As far as some educational tips, movements to avoid, you want to avoid overhead throwing motions, heavy lifting, swimming strokes that strain the shoulder, and any movement that's going to cause you sharp pain. If your shoulder doesn't get better and it is seeming to get worse, I want you to please call our office. so we can get you in sooner to reevaluate and possibly do some further diagnostic testing. If you have any other questions, please call our office and we would be happy to assist you. Thank you.